Okay. Thank you very much once again. Uh, we'll be we have covered the first two part of this intro course and training on ultra brief psychotherapy. Uh, we look at the reason why the therapy needs to be there to fill a missing gap, and the reason why it was developed and what the role it play, and we look at the foundations of the therapy. So we'll be going further so that we can learn what are the other skills that we need to learn before we can do the therapy. And part of what we did is for us to build some of the vital techniques. In today's session, we are going to focus on building skills in the following area. For every therapeutic engagement, there is for encounter, there is need for engagement, and almost all therapeutic engagement they will need to provide some coping skills. And apart from coping skills, one of the common things that all psychotherapists do is to problem solve. And after that, this will end this particular module. Then we'll move to the third and fourth module if time permits, so that we will now look at some more of the more core elements in the therapy, like hope enhancement and cultivating wisdom as part of what is needed to be able to treat and help somebody suffering from psychological trauma. From this, that we move to one of those core things that's necessary and essential in psychotherapy, and that is the engagement. And in order for us to have a proper engagement, we need to meet what we all know, which is called simply therapeutic alliance. That is the we in therapy. And simply by definition, it means a collaborative that is between the therapist and the client, the therapist and the patient, the therapist and the group that's receiving the therapy. And so the collaboration between them in terms of how their emotion meets in the intersubjective space, interact, and help to build a partnership that will facilitate the achieving of the client's goal for coming to therapy. So, and that's why the caution has been laid down there that therapeutic alliance is not about making friends. It is about how to become effective and trusted partners in healing. And research has shown us that when we look at the common factors why therapy works, we discover that one of the things, or what the research have shown us, is that therapeutic alliance, we discovered that therapeutic alliance contributed about 40% of all the variables that is needed for therapy to be very effective. So, and this is telling us that in order for us to be effective as a therapist, we need to keep building our skills of therapeutic alliance and practice it so that we can get to that expert level that any encounter, any therapeutic encounter, any of such interaction between you, the therapist, and the patient, the client, or the group, we automatically flow into this, and you will know whether you are doing it right or not. And that's why it's essential. And what are the three things that therapeutic alliance try to see that we be able to build upon so that we know that we're actually achieving that? And that is bond. We are supposed to be able to build a bond. It will help us to set goals, and it help us to say that we achieve the task. And when we say building a bond, building a form of relationship with the client, here you are going to serve more or less like a tour guide. So that bond is needed. And to do that, you need trust. Trust is very essential. Apart from building trust, we have to build empathy in the relationship too, where we demonstrate to the client that we feel your pain. We are not trying to be there that to be sympathetic to the individual, that we feel it. It's not that we know, just know your pain. And the relationship will be carried out in a non-judgmental fashion, which is with respect and with liking. with that desire that we want this individual to get well. And the goals of the therapy will not be easier to bring forward. With therapeutic allow will also help to facilitate. And that way we'll be able to have mutually collaboratively arrived on outcomes that the therapist will focus upon. Please, we can try to mute ourselves if you are not speaking. Please, anyone not speaking, please try to mute. Thank you very much. So, and the third aspect of commonly when we look at therapeutic alliance is the tasks that we need to set so that we know these are the things we need to work upon. We don't just only reach the goal, that these are what how to work upon it, what needs to be done, and this will start now bring ushering in those specific skills that the therapist has come with. Furthermore, is that when we are trying to build therapeutic alliance, these are some of the things that also entail in building therapeutic alliance. One is one of the concepts called joining, where we're able to uh, integrate with the patient, and that is the process of forming the bond so that we can help to facilitate goal setting. And the second aspect of therapeutic alliance, as part of the key technique we need to build, is the rapport, which is a relational connection between the therapist and the person receiving the therapy. And when we are trying to build rapport, it entails that we should be warmed, give attention, provide mutual trust, do it in a respective way, provide the help in a respective manner, not in a derogatory manner, and should be all will not lead towards the sharing of experience towards recovery and healing. And in doing rapport, these are some of the things that once we find these elements there, then we can, in more way than we might think about it, that essentially rapport is being attainable, and so that should be able to guide the rapport is attainable, and that is we should be able to ask and use the name of the individual that is receiving therapy from us. We should be able to practice active listening. We should be able to ask questions in an open-ended format, and we should be able to show empathy along the line. And in the process, we'll be able to find common grounds that will allow the therapeutic alliance to be built and developed upon and grown upon. And in this, we'll be able to understand better the role of the those things that Sigmund Freud brought forward when it talks of transference and counter transference, and with developing that it will also further guide so that we can be able to know this is how where to follow, this is the lead, and this what to follow. And in all doing all this, we have to show that we are genuine, we are sincere in the process. We are not just here for the sake that, oh, I'm just binded to see, we have to be able to build that genuineness. And I remember this one of the things Professor Dufa used to emphasize, that once you are doing therapy, some people, when you see them and you see their engagement, be able to pick all this in them, that they are actually genuine about what they are doing. And that demeanor, that the exude shows the quality of what it means to be a therapist. And this are not necessarily that people are born with it. These are things we can learn, and that's why they have been emphasized for us to pay attention to that. Briefly, I want us to practice one of such things to help us build rapport when we are with patients, so that when we do it in our this way, then we'll be able to see maybe we're building rapport or otherwise. So please, I won't mind now that in the next 30 seconds, let's quickly look in our environment and grab any object within our reach. Just one. Can we all quickly do that? Please, if we are not talking now, can we mute ourselves? Then when it's time for us to talk, then we can unmute ourselves. So please, at this junction, I won't mind that we can omit ourselves and in an orderly way mention the object we have grabbed. That's within our just one object that we have picked within the environment we are in. That's close to us. Please go ahead, Dr. Akujobi. Please go ahead.
Okay, thank you, sir. Good morning, sir. I picked the remote.
Thank you. And next person.
I picked a pen, Dr. Jennifer.
Thank you very much. Next person.
Okay,
I picked a pen.
Okay, thank you. Next person.
I picked a fork.
Thank you very much. Next person.
I picked a notepad.
Thank you very much. I think we'll pause here and go to the next aspect of this exercise. So please, for all of those that mention what we pick, I want us to briefly explain what it is and why it is meaningful to us. That thing that we pick and why it is meaningful. So please, just simple, just in a sentence or two, not too much description. So please, we can omit ourselves and go again in an orderly manner. Thank you very much.
Okay, this is Dr. Jennifer.
Yes, please go ahead, ma.
I picked a pen. The pen was closest to me, and I'm using it to take notes on this discussion. So that's what it means to me.
Thank you very much. Next,
This is Dr. Akujobi. I picked a remote,
thank you.
and it helps to control the air conditioner, switch it on and off, and regulate the temperature.
Thank you
Thank
very
you.
much. Yes. Next,
Okay, this is Akoni. I picked a fork because I was actually using it to eat while you were teaching. Thank you.
thank you very much. So, uh, did anyone want to add more before we go to the next part?
Yes, sir. Dr. Bartholomew, sir, I picked a biro. I was using it to write, and it's quite meaningful to me. It is essential in my work and career. Thank you.
Thank you very much. So, the next aspect is this: we want to reflect on that thing that we have picked, and by our reflection, I want us to give it a common theme. That what does this mean? Is it like somebody have said career? Somebody eating can talk about it. It's about what nutrition. Can we reflect on what you have picked and try to give a theme of what we hear about? This one, those who have not spoken can also reflect on what people have said and give a theme that describe or themes that describe what they've heard about what people have picked. Thank you. We can meet ourselves and go on, please. Please, who want to go first?
Okay, and this is Dr. Akujobi. And the remote, I think the theme I would say that's close to it is comfort.
Thank you. That's a very good one. Next.
Thank you, sir.
So the idea is that if you are building rapport, this exercise should help us to be able to see things that are there in the rapport and why it will be genuine. You want to add more?
Okay, sir. Dr. Bartholomew, I picked a pen. I mentioned career, and a theme I can pick from it would be growth.
Thank you very much. That's another very good one. So this is what rapport building entails. It's not just for us to try to look harmless or sheepish in front of the person, but this thing should be able to provide a reason for us to bond, for the goal to be a common shared goal, and so that the the task will help us to be able to understand how this will reflect things for us. And this is very essential when we are building rapport. So in essence, that after we have heard the themes like comfort, joy, memory, strength, career, growth, that how did it feel to share something personal in this space? I want us just to share our experience in this little exercise we do. How did it feel to share something we have all talked about? Somebody pick a fork, and all those things we have picked. How does it feel like to share something in this personal space? Hello, we're free to unmute ourselves and speak. Yeah, please kindly go ahead.
Okay, thank you, sir. This is Dr. Kujobi. It felt fun and it felt a bit light-hearted. You know, this is a very serious space, so it felt like a light-hearted, fun activity in amidst this seriousness.
Thank you
That's
very,
how it felt. Thank you.
thank you very much for sharing that. Who wants to add more?
Okay, okay, sir, if I can
Eh,
do that.
Please go.
Dr. Bartolome, okay, initially I felt a bit reluctant. However, while I did that, it felt like a serious activity.
Don't have to talk and
So,
connect.
and was meaningful.
Okay.
Thank you.
Thank you very much. Who want to add or who want to add more to that? Thank you for those who have shared what it is like, how this what they've picked, which is personal to them, what it feels like to share that experience. So, what this is essentially trying to guide us is that,
I can't talk.
please go ahead. Go ahead, please. Please, who want to talk now? You can kindly go ahead and speak. Okay. It seems there may be a digital challenge there. So maybe we'll continue because of that digital challenge on that end. Thank you very much for the contributions all and the participation. So what this is trying to tell us is that when we are trying to build rapport, uh, and there is difficulty, this is also an activity we can do, and it will now help to see that we can be able to bring out what the common themes in the person's experience is like. What will be the experience of pain or suffering the person might be having, because what we have done is not related to that, but it's helping to see that it brings us to the moment. It helps the individual to see that this is not a dangerous zone again. This is a safe zone. This is a trusting zone. And this is a zone I feel free to speak my mind. Nobody is going to judge me, and nobody is going to drag me back. Nobody is going to be uh, uh, derogatory to me when I speak. At least everybody here should be able to respect me for whom I am and how it goes. And that helps us to achieve that. So, and that is the beauty of building rapport in a therapeutic environment. And that is one of the main ingredients that allow therapeutic alliance to be made. It's not just for us to be present, to try to join with the individual, but the way we do the joining, the way we practice the bond that we make is very vital in order to achieve the growth in that therapeutic environment, and to allow the changes that will take place that will bring lead to the processing the pains and the suffering in order to bring about healing. And that is what this activity will have done to help us to see what building rapport is like. Thank you very much. And it helps us to see the genuineness in what we are doing, and there are all common things that is there in our environment that all of us want. And it can also help us to start to understand what will be what this person wants subsequently. Did this person want more comfort too? Does he want uh more joy because of what the experience will be like? It helps us to be able to start getting this, so that the goal of why the individual is in therapy will be imagining gradually, and we can start moving on from there. Okay. The next thing we'll be looking at is part of what it is. the skills we need when we are trying to still build engagement, and which is part of what it takes to build therapeutic alliance, what is called accommodation. And this is the deliberate and ethical adjustment of our interactions. It entails the manner we speak, how we try to look at the environment that we are in, that we don't make it non-formal, and we don't make it too formal, so that it can meet the unique needs, the characteristics wants of the patient, so that the we can be able to build the capacity of the patient, be able to explore the cultural issues that are there, and be able to understand the circumstances that surround the patient. And in this situation, we have tried to look at three words that look similar, but so that when we are trying to build engagement in therapeutic process and our therapeutic encounters, when we're trying to build engagement, and accommodation is one of those things that we strive to achieve, because once we achieve it, it allow the process of that engagement to be better, to keep growing, and to lead to the outcome that we want, which is to bring about processing of the experiences, the feelings, and the meaning of the pain, and the individual can heal from that. And accommodation is a technique of telling us about how, because it's very essential for us to know how to adjust when we are with patients. It's not about we being rigid. And this is very essential, that in building therapy, we need to build the experience of flexibility. Rigidity is not part of it, and accommodation help us to do all these things. And this is the why, so it's called the adjusting how technique. And this is very essential, that whatever technique we are delivering, we should know it's not supposed to be, we are not supposed to be rigid about it, because we learn about those techniques, and most of us may think that it must just be rigidly developed. No, we learn to modify it. We don't throw away the core of the techniques, but we learn to modify it so that to be able to flow with the need of this patient, to be able to flow in the environment that this individual is, so that whatever is taking place, it bring about changing the core of the task that needs to be addressed. And an example is this: using metaphors instead of clinical jargons. Because at times when we speak with patients, we may use our jargons, that when we say you have psychosis, the person doesn't know what we are talking about. When so And it is for us to be able to sit down with them. We say this one is have an hallucinatory experience. The person doesn't understand what we're talking about. So it is for us to use accommodation, to be flexible, to be able to see that the patient experience that is given us, because an expert in doing that, and our own experience as experts who have learned what those things is, we're able to see that we are speaking similar things. We are not assuming that this is what the patient meant, and we don't want to assume that the patient should understand what we are talking about. So accommodation is one of those skills that we need. Modification can take place, which is changing what is done, altering the core components of a treatment protocol, and that is very dangerous, because when we are treating somebody, those core things that are needed in the therapeutic modality that we're using is very essential that we don't modify it. So we try to modulate it, because when we change how what it is, then we are not going to get the same outcome that we want. So we don't just me. I don't agree with this, so I'm going to do something else. No, because we have to be uh, flow with what that therapeutic modality is letting us know. And because it has been put to test, it shows that it's going to help us get what we need. But we can adjust it, we can make them adjustment there, which is not something that we just change completely, because that's going to bring trouble. And for instance, but for people who might be doing exposure therapy, and when the patients will skip it in the process of helping somebody who have experienced PTSD, that is going to be a major flaw, because we are not going to help the individual to be able to achieve catharsis from the pain that is going through, and the healing process might not even start, much less of trying to build upon it. Uh, Another thing is also fidelity, and this is also the other extreme of when we are trying to do a therapeutic modality. We just say this is the way the manual has said, and we do it just rigidly like that. That's also not good. With that, we'll not be able to achieve accommodation, because by the time we do that, we are so rigid that this is not flowing within the milieu of understanding of this person. So the person cannot utilize the modality, the technique that this treatment modality is telling us to use. The person cannot understand it, it cannot gel with it. And when the person cannot flow with it, then it becomes difficult for this individual to benefit from it. So we want the person to then, our fidelity should not be rigid. Our fidelity should not be changing it. That we just I felt that this person, no, it's not our own calling to do that. It's for the individual to feel that, oh, I've tried this and I cannot do it. Then and we have to. So that's an accommodation will help us to be able to do the right adjustment, and how to do the right adjustment. That's what accommodation is telling us. And this is very essential in engagement, because every therapeutic opportunity is an engagement towards healing. And that is what accommodation is telling us. That when accommodation is there, it's telling us that we learn to adjust the frame to fit the picture. We don't say this is the we don't create a frame and now squeeze the picture inside it. I'm sure with this, what some of us in the digital world do when we want to crop. We get a beautiful picture and we crop and create a frame the way we want. No, accommodation is telling us that this is what the picture is. We now create the frame. The frame we create must fit that picture, not that force we have a frame and we are forcing the picture into it. And that is, the person's experience is very vital. So the frame will create that will help us to engage, to see that the goal set and the way we work with it, we fit it and allow for this adjustment to take place, and not that we rigidly force the person experience into this is what this you force the person experience into it. Then we are not going to get accommodation, and that is going to challenge the engagement process, and the beauty of therapeutic alliance is going to be troubled. And once therapeutic alliance is troubled, then it becomes very difficult for one to achieve the goal of healing in therapy. Like I've said, more than about 40% of what will help patients to heal has to do with therapeutic alliance. So, what is there that as a therapist, what are we supposed to do when we want to help to guide change, to bring about accommodation? And this is what these listed things have tried to tell us. We have to learn to harmonize the style and the techniques of the therapy we are doing to meet the patient, the client, or family where they are. We don't force them to where we want them to do. We meet them where they are. They will start developing, growing, and moving at the pace that will allow them to grow, allow them to heal, so that they can benefit from it. The therapist, for it to do well, he has to lay the groundwork for the restructuring intervention to take place. And without practicing accommodation properly, then the patient might be one of the reasons patient might not do homework, might be one of such reasons patient will not understand, that will not see the value of what we ask the patient to do. So this is very essential. And it ends using that journey techniques, which I mentioned earlier, which is one of the core things in building therapeutic alliance. And once we're able to do the journey very well, then it will help us to be able to appreciate the core condition of the individual, and how treatment process will help to start interacting with it and bring about change. And it helps to lay the groundwork and make possible the restructuring intervention by which the patient, the client, or family all begin to understand and bring about change. So that is one of the first common technique, very vital techniques we want us to see, therapeutic alliance. Another common technique we will want to learn is what will bring us to the moment, which we call grounding. And grounding help us that wherever we have, we want the individual to be able to able to be in the presence. We want the individual to experience less discomfort, and we have to do certain things in order to calm the individual down in the therapeutic process when things become panicky for the individual, become discomforting for the individual, or there is loss of attention, focus. We need to do something, and grounding is one of those techniques. The one we are describing here is one of the most simple ones to do in order to achieve grounding and bring about a profound effect in doing that. There are many, many different ways to do grounding, but this is one of the simplest way, and that is to do the deep breathing exercise. I'll assume that we all know what the deep breathing exercise is, but one thing I want to emphasize upon that is to do deep breathing. There are many things we might have seen online that people create so many versions of their own. But for us to know that when we are doing it well and we're helping the patient or the client or the family, the group to do effectively, then we have to ensure see that deep breathing has four parts. The first part allows the individuals to breathe in slowly. Remember, nothing is going to be rushed. The person breathing slowly. The second part, the person stop breathing in. You hold the breathing just briefly for a second or at most two. Then the third part, the person breathe out slower, which means the person will breathe out longer than the amount of time that it takes to breathe in. Then the person will rest again. That's pause again and do it all over again. And once we are doing this well, then we are helping the person to do the right way to breathe. And that should bring about the process of grounding, bringing about calmness and decreasing the tension for the individual at the moment, at that point in time. So this is very effective for us to do. Please, when we are doing it, it's the rule that we should remember that when we say deep breathe, it's not just the breathe in, breathe out. Because by the time we do not follow the rule, we are going to breathe lead to panic, and most people will call it deep breathing. They say 1, 2, 3, breathe in, 1, 2, 3, breathe out. That is we are bringing panic, and that's why some people might not benefit from it. So please, we should try to understand the time it takes to breathe out is longer than the time it takes to breathe in. And when we are breathing in, usually our tummy will go down. And when we are breathing out, our tummy will come up. This also helps us to see that we are doing it well. And there must be rest between breathing in and breathing out. And breathing out must be longer than breathing in. One of the other things that we can do in order to bring about grounding is ability to use humor. This is not a skill or task that everybody have, but it's a thing we all keep building along the way. And that is when there are opportunities that we can bring in jokes. Now, we do not the typical jokes that people do that will bring about trouble, but it's a joke. That's why the term humor is this, because we remember it's one of those uh, matured, LD coping, that's matured helping coping skills from that we learn from the psychoanalytic schools when we are talking about defense mechanisms, and those are the LD defenses. And building it is very essential. And this is one of the skills people we call comedian have mastered. So at times, if we know we have such skill, we might be able to use it effectively. And the kind of skills that may come there is not just to throw any out of jokes from it or any out of jokes comedy or humor. No, it's for us to be able to see that it's appropriate for the person and might bring about the process so that it can help to lighten the situation for the person and bring about grounding for the individual so that to reduce the tension. And that's where the concept called gallows humor, that is an example of a gallows humor. The person is about to be beheaded, the gallows man is there, and the person who is about to be beheaded says, "Excuse me, sir, I have an itch about 4 inches down from my left shoulder blade. Could you please scratch it for me?" Which, if the person tries to scratch, it's going to cut off his head, but he still be able to make joke under that situation. And that's why the gallomat is also in a way confused. It's funny for people who might be in the dark place, because for them, can you even remember to do something like this? So, and then you are trying to challenge the tension that build up there. So, and the gallo human, it can be used for coping. I'm not saying all of us should use this. We must have built skills in this before we can use it. And but it's good to bring it to the fore so that we don't people who have the opportunity, who are good in this, can use it well. And if you have been using it with patient earlier on, there you can see that, oh, this part of what I'll be using to bring about healing in the process for the patient. That I'm using one of those therapeutic skills of grounding, but I don't know that's what. And it's also mean that we should learn to do it well and learn not to swerve off the road. Some people might use it and later had many other things that will bring more tension for the individual. And they may think that it's just for them to laugh. No, it's not for you to laugh. It's about to bring about relieving of that tension for the patient. So please, we must avoid whatever is insensitive in the process so that we don't complicate the issue for the uh, client. One of the skills that we practice in of all form of therapy is called normalization, and that's what we will try to look at. What does it mean to use normalization? Normalization is very essential. In fact, it's one of the core techniques that is used in supportive psychotherapy. If you cannot use normalization, then it becomes difficult. And that is why the most common therapy that I expected that everybody will learn, even from medical school, that once you learn the rudimentary, is what is called supportive psychotherapy. And one way or the other, we have learned what normalization is because it will help us to see that we can address the emotional and cognitive effect of the pain, of the trouble, of the challenges, of the condition the person is there that is about life or death for the individual, and that will be able to address it in a way that helps to bring healing for the individual, that help the individual to understand that yes, this is has happened, but I'm a human being, and this do happen, and I can get over it. I can recover from it. I can move forward from it. And it's one of those skills that from medical school we start to learn, and also from people who don't go to medical school who have been in other form of learning in the health profession, the nurses, and others like that. They also learn normalization because it's one of the things that we all do. We try to help the patient to understand that this experience is not uniquely describing only you, that it has come, there are people who have seen with worse or more troublesome situation than this, and they do recover, and this is what their story looked. So in doing that, which some of us do, it helps to bring about that concept called normalization. And that's why I've just tried to take time to try to bring this forward. That normalization, there are many things that entails in doing normalization. And when we're able to do all those aspects of it, then we'll know we're doing normalization the right way. For instance, we'll be able to identify the emotions that the person is having. That is a skill that if you don't identify, then we cannot address the emotional trouble that the person is having as a result of the pain. So to be able to identify the emotion, you see what kind of emotion is this person experiencing that is discomforting the individual at this moment. Like I've said, that watching that animation will help us to that building our skills in identifying emotion more than just happiness and sadness. So the inside out. I checked the last time, I couldn't get a good one yet. But if I get something related, I'll still share with us. But it is there that if you get it, you'll be able to start understanding. Because once you can understand the person's emotion, then you can understand what it is like, and you can help them to normalize that yes, you're expected to feel this. But if you let this overwhelm continue, then this is where the trouble is. We feel it because it helps us to deal with the situation this way and that way. But after this is no longer useful, we need to do something about it. So we must be able to understand the emotion, the person to validate it. There's a normal way to respond to grief, a normal way to explain to respond to pain, a normal way to explain, and this is in the cultural context. I also we must be able to address the physiological symptoms that are related to it. So when somebody is having palpitation, we should be able to relate with it and explain that when this happens, this is how people respond. This is how it feel like in the body. If that's what you're experiencing, which means it's normal that people should feel that, you let them know that. And especially in terms of trauma that we're looking at, we'll be able to relate it to. Then we should also be able to reduce the stigma people may feel from it, that it is not, it doesn't mean one is weak. That is why one is at the hospital, where one is at the clinic, one is at the therapy office. No, no, that's not it. Because and one of the way I used to tell people in these situations to let them know that our politicians are the most powerful among us, but they always come and seek for our help. So seeking for help is not a sign of weakness. In fact, it may be a sign of wisdom, a sign of strength. And so we'll help them to see this, that everybody asks for help, including our politicians. They all beg for our votes. No matter how they might have treated us, they still come back and beg for our votes, irrespective of what it is. So because they know they need it to win election and move forward. Then and in when we do normalization, we're helping the individual to enhance the coping mechanism they are using that is working, and helping them to start to drop the one that are not adaptive, that are not useful for them. They will help them to facilitate how to talk about the pain they are going. Because if they don't start telling the story of that pain, of that suffering, then achieving catharsis, bringing about relief of that psychological story of pain that is there in their mind, might not be easy. And when we talk about the one we do in our last session, we talk about things about memory fragmentation. And so, in order to be, we normalize so that it will facilitate for them to be able to tell the whole story in full. And by doing that, it helps the survivor to share their experience and get relief from it rather than trying not to relieve it and the pain continue to worsen, and try to bring more about avoid more avoidance than is necessary. That in the beginning, yeah, it's needed, but now we don't need the avoidance. The distressing situation is not there. So let's talk about it so that we can deal with it and move forward from there. And normalization helps to promote social reconnections, and we know the role of social support in what we do. So I'm not going to emphasize that. It also helps to support identity reconstruction. That we know this is what we need. This is where it has shattered our former way we look at ourselves, the integrity we give ourselves, the esteem with which we carried ourselves and live our life. It has challenged it, but we need to rebuild it so that we'll be able to regain it back and continue with our life. And once we do it well, it enhances treatment engagement, it reduces avoidance behavior, and it helps to foster resilience so that it helps us to reframe the responses, the pain that the person is going through, so that the person adapt well and start adapting more better and live a normal life. So one of the other skills we also need to learn as vital to this is what's called problem solving skills. And this is useful and essential for us to have and use. And this goes that we need realistic optimism to view coping. And in order to be able to do this, we need to understand that to solve problem, we need to understand the role of emotions. I'm emphasizing it again. And one of the techniques that has been used in treatment that are supported by research is to do a problem solving, action oriented approach. These techniques is what is called the SSTA. That when the individual feel these emotions of pain, have these thoughts of challenges, or this physical trouble come as a result of the health issues and other that brought the individual. Then we ask the individual to deal with this in order to be able to cope with the stress. Stop whatever you are doing and try to notice yourself. Feel your body and notice what is the feeling I'm having now. And when you can feel the feeling, then you can notice and label it. Call it the right name. I'm feeling sad. I'm feeling disgusted. I'm feeling indifferent. You should be able to label the feeling so that way the individual can say, oh, I'm feeling joyous. So the individual should be able to notice the feeling and label it. Then the individual should be able to slow down so that, and as the person did not really stop to notice, is when you slow down, it gives the person chance to reduce more physical sensation that surround the individual and be able to properly appreciate the feeling he or she is having there. Then the person think that, oh, this trouble that I've noticed, physical, uh, emotional, or my thinking way that I've noticed, the way it might be that, okay, how do I address it? And that's where the person start thinking about the trouble that will be identified and try to problem solve it. And once you try to do that, he used so many ways to do the problem solving. Then the individual acts by putting the best priority work together out into action to start to solve the trouble, the challenges that has come as a result of that follow the trauma or that follow the condition the individual is going through, that is experiencing. And that way, we help the individual to develop an action plan that will bring about well being. And to bring about that, this is an example of what an action plan to bring about well being that try to encompass what I've tried to discuss earlier on before. And this way, you can look at it in this way that, okay, assess the current state. You stop to assess the current state. You define whatever is there. And in some ways, we try to use, for those who are research oriented, we try to use not only our clinical approach, but we try to use some specific measuring skills to try to assess what the person is currently having. So we try to use them depending on what we are looking for. If the person is stressed, we can look at that, the distress, the depression, anxiety, and stress scale. We can use hospital anxiety depression scale. There are many of those scale that are there that we can use depending on what you are looking for. If you are looking about the level of well-being of the individual, we can use what they call the PAMA profiler scale. If there are sleep problem, we can use the insomnia measuring tools. So there are many things we can use, and that is essential for us to use to assess the current state. And once we're able to do it, then we know what is happening and how do we deal with it. It's for us to say that, okay, we can journal the current state, rate the physical, mental, or social well being that the person is having, and we can use our visual analog scale on a scale of 1 to 10. What does this mean to you? 5 being the halfway in between, 10 means it's overwhelming or doing well, 1 means it's on not doing well at all, or the pain is least experienced, the suffering is least experienced. So depending on which of these we have picked, and that way we are able to identify what the trouble is. Then that is what we call problem identification and problem solving. And when we have identified the problem, what do? We set smart goals to address it, and that is goal setting. And we look at it. Let's brainstorm. How are we going to solve this problem? So if it's about the person inability to exercise, then we can create specific measurable goals to achieve that. Okay, the doing 30 minutes walk 30 minutes walk 5 times per week is good. Then and we need to prioritize this goal we have set. So let's look at other goals that are there that may conflict, that may challenge this, that okay, I need to watch my feeding habits. I need not to take this kind of medication I used to take before. I need not to take this kind of drink I used to have. I need not to go to this kind of place I used to go before. Or I need to start going to this place that will help me achieve my goal. I need to start rebuilding my relationship that I have been impacted negatively because of what has, those are the smart goal will help us to address all this. And once we can put them in place, we can use app to help us track whether we're achieving it or go. And that way we are able to go achieve goal setting. Then we try to choose strategies. And that is where we suggest many alternatives to help us to be able to achieve what the goal we have set. So that when we do it, then we can now start seeing and see whether our pain is being relieved based on the identification we do in the first day. Is the distress level decreasing or increasing? The solution I've used, is it helpful or not? But please, when we're trying to suggest solution, we should suggest at least 2 or 3 per each challenges, by each problem, by each thing that has been, so that it will allow them, we cannot look which one will be much easier, which one is likely to solve the problem. Collaboratively working with the patient or the client or the group, so that way it will now help to facilitate, to say that when the person practices it, we should be able to achieve what we are looking for. And from there, when we generate the alternative, we build an action plan. And that is, we plan to implement. Okay, this is what we have planned. This is how we are going to implement it. So, and this is it that the days might be busy. If you can't get up to time, 30 minutes walk in a day, then let's start with 5. Let's move gradually to 10. Let's move to 15. We are doing it in piecemeal to allow it to be achievable. Or if the person can do 30 minutes and it's not possible, then let's see if you can try to cut it to 30 minutes into pieces, and the individual can see how much minutes he can get during the work environment, and be able to achieve it while still working. So all these are put in place to see that we are saying that we are planning and ensuring that we can implement it properly. Then we monitor and adjust as it goes on, and that's why we keep evaluating our assessment tools. Keep adhering, we keep looking what is the improvement in this or that, which one is working, which one is not working, and we do this in a way, and this helps us to systematically do it so that we achieve the purpose. And that way we're able to address barriers, so that whenever we find that this is an obstacle to this, then we use our creativity to create new smart goals, choose new strategies. Then we build on, we work on it, we implement it, and see how it goes to see that it helps us solve the problem. This is a simple practice where we can also do, but we will skip it for now. But it's something that, since the slide will be shared with us, that we can go through it. But briefly, it's telling you on this a five structure step model to counter helplessness. And this is essentially brought in because if you remember the last session we had, we talked about some thinking pattern in trauma. And one of the thinking, two of them is what, all or not taking or inflated responsibility. So if you want to use problem solving to address it, this is one of the things we can do. So we can try to look at it that, okay, in terms of this all or none thinking, what is the problem orientation of it? So we are trying to help the individual that, okay, this is the way you think. We have identify the problem. So what are we going to do? That we have to change this in the impossible thinking mentality to that yes, this problem can be solved. And that is essential because it will help us to be able to see, okay, we have identified this. And by that we can define it specifically what is the most manageable part of this problem right now. Because when the person think all or not, then we'll be able to identify some part of it. This is the problem. I felt I can never go and face my former friends before I went into this shameful trouble that has brought me to where I am now. And I'm now downcast, I'm withdrawn to myself, for example. So when it comes like that, then the individual have to look at it. What is it that we can we create a greater distance? So we define what the problem is. We look if there are parts to that problem. Then we generate solution, brainstorming without judgment, and we list all the possible, even silly ones to address this part. Then we make decision. We weigh the pros and cons. Which solution feels more doable and likely to help. Then we implement it. Like this is it. This all or not thinking means that we need to modify the way we are thinking this way. That it's possible to do this. So this is one of the first steps we do about it. When this come, let's stop thinking about this. Let's replace the thinking pattern, and that way we start addressing it and moving forward. Thank you very much. This is one of the first skills that is essential if you must do the ultra brief therapy. And this is in a way general to most of the psychotherapy, and it's assuming not that we don't say that we don't do the therapy, but it's like Prof has make note to us the last time that we are trying not only just to teach how to do this therapy, but also to create trainers from it, so that the process can be trained to others too and shared based on the outlined modalities that have been put in place. So I will pause for the next few minutes, then we'll try to take one more session for the day before we call it off, so that we'll be able to achieve our goal of those many things that we need to do before the practicum comes into being. Thank you very much.